Hey, today we want to address one of the most common complaints or syndromes that we get with our baseball players. A lot of times baseball players will complain of elbow pain and sometimes to a little bit lesser extent hand or wrist pain. Typically when they complain of pain in the elbow, it's more on this medial side. The medial epicondyle is the origin for a lot of the flexors of the forearm as well as the wrist and the fingers. So you can imagine when someone's gripping the ball and throwing it repetitively, they're vulnerable to those types of overuse injuries. What we want to do today is I want to explain some things that you can try at home that may help before you seek out some outside intervention. So common trigger points, there's a couple muscles that predominate this aspect of the forearm. The first one is called the Flexor Radialis. Most common trigger point for that muscle is going to be about 3 inches below the crease in your elbow. So if you find the crease, you go down about 3 inches, and if you flex that index finger of your hand, you can feel the muscle contract. If that point is tender, you can work that trigger point. You can do a little bit of friction type of massage like so. You can do a deeper stroke. You can even take a lacrosse ball and work that area. What I've found to work best is if you hit an area for about 2 to 3 minutes. That really works well. Another common muscle is the Pronator Terese. Pronator Terese runs from the medial epicondyle down across to the radial bone on this aspect of your arm. And what it does is it turns your arm over like this. So common trigger point, if you go about 1 inch to 1.5 inches below the crease and just a little bit more on the medial aspect here, and you turn your arm over, you can feel the muscle pop out into your hand. Again, if that's tender, you can do the same type of strategies as you did before. Either the thumb, friction, you can use your knuckle, you can do a deep glide stroke, or you can take a lacrosse ball and roll over that spot. Another muscle that contributes to that pronation is the Pronator Quadratus, and that muscle lies a little bit closer to the wrist. So if you go down and you have some wrist pain, or if this point down here is tender, you can do the same thing there. Another muscle, Flexor Digitorum, runs from the epicondyle down to this pisiform bone in your hand. What you'll do, most commonly, that point is going to be about midway down. So if you go down and you get on the medial aspect or the ridge of the ulna bone, and if that point is tender, especially if you flex your wrist toward the pinky side, that's a good point to address there. Another muscle, palmaris longus, I've seen this in plenty of pictures. They'll present and they'll describe some pain right in the palm of their hand, and sure enough, they'll be tender about midway down the arm. There's a muscle called the palmaris longus that contributes to, well, what it does is it helps you squeeze, flex the fingers as well as the wrist. So again, if you just go halfway down your forearm, this time about right in the middle, if that's tender, work that muscle. Last but not least, the Flexor Digitorum. There's an aspect called the profundus and there's an aspect called superficialis. So they're kind of one and the same. One's just a deeper layer than the other. The superficialis is like the second layer of forearm muscles, and the profundus would be that third layer. So again, if you flex the fingers, you can kind of feel those muscles, the muscle belly and the tendons pop out. These 2 points tend to be a little bit more distal down the forearm. So again, about halfway down, if you flex the fingers, especially if you do that against resistance, if you got someone to give you a little bit of resistance, if that's tender, work those points. Now, I've given you several points. They could all be involved, maybe just one of them's involved. But try this at home. If you do it, and you do it a few times, and you still don't have any resolution or relief of symptoms, then it's time to seek out a skilled manual therapist that can do some other strategies that can resolve the issue. This is Baseball Think Tank. Talk to you soon.